When you hear the words heart blockage, what's the first thing that comes to mind? For most of us, it's getting a stent, right? It seems like such a direct, straightforward fix. But what if I told you the best decision, the one for long-term health, is actually to wait? Today we're going to dig into why not every heart blockage needs a stent right away.
So imagine your parent gets this diagnosis. Man, that news can fill a family with so much fear and this sudden sense of urgency. All at once, you're faced with these really complex decisions, and you just want to do what's best. The pressure to act immediately feels immense, but the right path forward, well, that often requires some very careful thought.
And this right here is the crucial point. The real goal of any treatment isn't just about mechanically opening up one single blockage. It's about ensuring the patient's overall well-being, their safety, for all the years to come. And looking at it through that lens, it changes everything.
So, what's the thinking here? Why would a cardiologist, a doctor whose whole job is to fix hearts, decide that a stent isn't the best immediate choice? Well, it often comes down to a really simple but powerful assessment of one thing: blood flow.
This is just a brilliant way to picture it. The coronary arteries, they have one main job: deliver that oxygen-rich blood. Think of it as water to the heart muscle, keeping it nourished and strong, just like watering a garden.
What's so interesting is that not all blockages are created equal. You could see a narrowing of, say, 50 or 60%, and while that might sound really serious, it might not actually be choking off the blood supply. If enough water is still getting through that hose, the heart muscle isn't being starved of oxygen.
And that is the million-dollar question for the medical team. They have to assess if that blockage is causing what's called ischemia, basically a lack of oxygen. And, location matters immensely. A narrowing way down some minor vessel has a totally different impact than one at a major junction. So if the flow is actually sufficient, an aggressive intervention might be riskier than it's worth.
So if it's not a stent, then what? For many patients with stable conditions, the answer is a really powerful and much less invasive alternative: medication therapy.
This slide just illustrates the difference in approach perfectly. A stent is a spot treatment. It fixes one specific problem area. But medications, on the other hand, they work systemically. They protect the entire network of blood vessels and improve the heart's overall performance. It's a whole different ballgame.
So how does this work? It's actually pretty clever. The heart muscle gets its blood supply in between beats during a phase we call relaxation. Certain medications, like beta blockers, can gently make this phase a little bit longer. This gives the heart's vessels more time to deliver that vital oxygen. Basically, it helps the heart eat more efficiently.
Of course, no decision is ever made in a vacuum. A huge part of any doctor's job is weighing the specific risks for each individual patient before they recommend any procedure at all.
A stent procedure requires some powerful blood thinners. So, if a patient has a history of bleeding strokes, stomach ulcers, or even a low platelet count, the risk of a really dangerous bleed could actually outweigh the benefit of the stent. Every single coexisting condition has to be factored into the equation. And this just reinforces that it's never just about the blockage. It's about the whole person. These decisions are often made by a multidisciplinary team, bringing in different specialists to make sure the final plan is truly the safest and most beneficial for that one specific patient. Now, this is where you, the family, play such an essential role, especially when you're caring for an elderly parent. Your insight and your support are absolutely critical. And doctors consider these practical, real-world factors. If a patient might have trouble communicating their symptoms, or if there's no one at home to make sure they take their crucial post-stent medications, the long-term success of the whole procedure is at risk. A perfectly placed stent is only effective if the follow-up care is consistent.
To help you navigate all of this, we've put together a practical checklist. You can use these 5 points to guide your conversation with the medical team. This will help you become an active partner in making an informed decision for your loved one.
This is so important to remember. When you're in that hospital room or at that doctor's appointment, you are not just a passive observer. You are a crucial part of the care team.
You're the one who sees the small changes at home. You can make sure crucial medications are taken on time. You can voice concerns your loved one might not be able to express. Your advocacy is one of the most powerful tools they have.
So, the crucial point is this. Armed with this understanding, you are empowered. The next conversation you have doesn't have to be about demanding a procedure, but about collaborating on a plan. It's about asking the right questions to achieve the real goal: a better, safer, and longer life for the person you love.